Thank you very much and welcome everyone. Thank you for having me this evening. I have the brief to talk about the role of the nurse in managing diabetes. Now, unfortunately, I can't share the screen with you, but I can also send the slides to Hanif so that you can have them at a later date. So, in talking about diabetes, as Keith said, I've been in the world of diabetes for a long time, and I'm sure many of you, if you have diabetes yourselves, you'll realize the importance of the diabetes nurse in helping you to manage your diabetes and to keep you on the right track. I believe, and I say this in governments, I say this to my patients, I say this to my GP colleagues, consultants, etc. So I believe the diabetes nurse, or the role of the nurse, because it's not just a diabetes specialist nurse, is really vital and really important in the care and management of diabetes, any form of diabetes. So this small presentation, I put together something about our role, and I start with primary care, looking at the practice nurse role, or the practice nurse with a special interest, because this is a growing breed of nurses, as more and more diabetes care is managed in general practice. I'm looking at community diabetes specialist nurses, which is the next tier up. They still look after you in the community, but they have more specialist skills and knowledge. And of course, the hospital diabetes nurses, we know that is very important for those people with very complex diabetes and who may be either in a hospital ward or bed, or maybe in a hospital outpatient clinics of some sort or another. And then, of course, the nurse consultant role, which I happened to reach, in the last 14 years, which is the pinnacle of the role. So when you go to your practice nurse, or your practice nurse with a special interest, they're there to support you to manage your diabetes day to day. And most diabetes care is done in general practice. And most diabetes is diagnosed in general practice, and it's often by your nurse. When you go in, you might be feeling tired, you might be feeling thirsty, you might be feeling out of sorts, you might have lost weight. And the nurse is the one who will pick these symptoms up and then, take that forward to a diagnosis potentially of diabetes. So they also will help you to understand your diabetes and the type of diabetes you have. And it's really vital that you know which type of diabetes you have, because there's different types. The three main types I'm going to refer to this evening is type 1 diabetes, where you don't produce any insulin at all to keep your blood sugar levels steady, or you might have type 2 diabetes, which is a gradual onset of diabetes where your blood sugars start to rise as your insulin starts to wane. And of course, there's the gestational diabetes, which we talk about, and this is for pregnant women who become pregnant during diabetes. The important thing here is to have regular reviews. And, please don't miss your appointment if you get called up for a review, because you don't often feel things going on with diabetes. It's only until someone told you, by the way, you have diabetes. Or sometimes, in my experience, I've seen a lot of people who have had a stroke or have had a heart attack, and then they were told they had diabetes. And your practice nurse is really vital. She explains what you need to do, how it should be treated, and help you to allay some of those fears and that you may have when someone tells you you have diabetes. It's quite concerning. And also something about the treatment, with diet, with tablets and insulin, or combination of all three. So your practice nurse also, she talks about, your regular reviews and your clinical management plan, which you should be the most important person involved in that management plan. How many visits you need to have with your practice nurse or your GP throughout the year. And she'll also set your annual review date, your MOT check, your check where we look at you as a whole, and sometimes link that to the date of your diagnosis. So if it's the 1st of January 2020, then it'll be the 1st of January 2021. Or some people like to link it to their birthday, and because nobody ever forgets their birthday, I don't think. So that's another date you can actually remind yourself of when you should have that really important check. So along with that check, you need to have an annual eye check. This is really important, because often you can't feel, you can't see what's going on at the back of your eye, and serious things can be going on. And if it's not checked and not treated, this can lead to blindness. The other important thing is to have an annual foot check, and that's about looking at the nerves, the circulation, the color of your feet, whether you've got dry skin, the hard skin, whether you've got, ingrown toenails or verrucas. All these sorts of things are really important to pick up early and treat and manage before something serious goes wrong with the foot. So the blood tests, which you're probably all familiar with, that you have, including the HbA1c. That is a blood test that looks back retrospectively at 3 months, taking into consideration the red blood cells and the amount of sugar that sticks to them, and then gives us a result in percentage or millimoles per mole. And that's called your 3-month average. That's a really important thing to remember, 3-month average, or HbA1c in medical terms. A target would be set specific for the individual. So no two people with diabetes will have the same targets. No two people with diabetes will have the same treatments. So it's really important to think of yourself as an individual with your diabetes. And the same goes for cholesterol. We need to know our numbers. Anything less than 4 is really good. And blood pressure, really important as well, to have a really good steady blood pressure of less than 140/80. And if you have kidney disease, we're looking at an even lower blood pressure of 130/80. We also look at the kidney, liver test as well, and also more in-depth, blood tests around your kidneys and how they're functioning. In terms of having your reviews, it's important to have your blood test 2 weeks before your appointment. And the reason for that is that the blood test results can come back, and you can then have a look to see, yourself, what goals you want to set for yourself for the coming year. It may be weight loss, it may be getting your HbA1c down, it may be reducing your cholesterol, it may be reducing your blood pressure, but it gives you the opportunity to take control and to be the most important part in driving the care and management of your own diabetes with the support of the nurse. You may be asked to do some blood glucose monitoring using a little meter at home where you prick your finger. And we're getting more and more up-to-date technology where we can have scans and things like that, where you don't have to prick your finger. But only certain people with type 1 diabetes and children at the moment can access that on the NHS. But it's available out there if you can afford to buy it. It's available for you to buy. One of the important people in the multidisciplinary team alongside the nurse is the dietitian. And the dietitian will help you to look at your own native foods. You don't have to have, types of foods that you don't identify with. For example, English foods. I'm African Caribbean, so if I had diabetes, I'd want them to tell me about, a sweet potato and rice and peas and things like that, I eat on a, daily basis. And the important part of the role of the dietitian here is also to give you something that you can work with and set you realistic goals, and not to stop you from eating the things you enjoy, because we know we can eat almost anything in diabetes. We just have to manage how much glucose, how much carbohydrate, how much fat, sugar and salt is in that food. So if you remember those key things, reduction in salt, reduction in fat, reduction in sugar, and not too much complex carbohydrates, you should be able to manage your diabetes really well, and also your weight. Exercise is also a really important part of managing your diabetes because it sensitizes you to your own insulin. So in type 2 diabetes, where your insulin isn't working as well as it should, when you exercise makes it work as well as it should. So it takes the glucose or the sugar from the blood into your muscles to give you energy. And then if your diabetes becomes a bit more complex that your practice nurse and your GP can't manage, then you get stepped up to what we call a diabetes specialist nurse, also based in the community, probably from a GP center, a practice or a health center. And she will have more knowledge and skills around, more of the new medications that are out there available. And it may be, you might need to go onto insulin or any another injectable therapy called a GLP-1, which helps your own insulin to work well and brings your blood sugar down much more efficaciously. And the nurse can give you support when you need it. Your nurse should be your critical best friend, should be the person who you can talk to, about any issues regarding your diabetes, and she will find you the support that you need. So in terms of talking about who supports the nurse, we've also got the podiatrist and also our medical consultants or GPs. They then will look at the medical aspects of the condition, but always importantly to keep you involved in any decisions that they're making in terms of your care and management. So the team will set up an individualized, what we call clinical management plan, which you own, and you will actually work with that, and we will support you to achieve the goals that you want to achieve to improve your diabetes. It's unique to you. As I said, no two people with diabetes are the same, and your plan is unique to you. So even if you have a sister, a brother, a cousin, a friend with type 2 diabetes, for example, their diabetes will be different to yours in the way it has manifested and the way it may be treated. And often I get people saying to me, oh, my brother has got this sort of device, or my sister's got that, or my friend down the road's got the other. It's not a really good idea to compare. You can share ideas, but not to compare how your diabetes is treated to someone else's. And then, of course, we have the tip of the iceberg, the hospital diabetes nurse, who is part of a multidisciplinary team as well. And she will look after patients in an outpatient setting or also on the wards, but also in more complex clinics where patients may have diabetes and kidney disease, liver disease. Some of them may have cancer, unfortunately, may be treated with steroids and chemotherapy. So you can see from this discussion that diabetes care is in about 4 different levels, and you have 4 different levels of specialists, and with the different important competencies to support you at each level. So in secondary care, you also got insulin pump therapy. You also got complex insulin regimes, combinations of tablets and injections. And you also got the Freestyle Libre, which is the most up-to-date blood glucose testing sensor, which helps you to protect your fingers. Most of you have suffered over the years with pricking your fingers time after time. This is a sensor which will help you just to scan your blood results. It shows you when your blood sugars are going up, shows you when they're stable, it shows you when they're going down, and you're hitting the hypo level. And it also can give you an average of an HbA1c. So also these specialist nurses actually look after pregnant women in the antenatal clinic. And there's also the young adults who are around 18, 19, who are transitioning into the from a pediatric clinic to the adult clinic. And then, of course, you have the consultant nurses, like myself. This came from Tony Blair's concept. I think that, Keith, you may remember when he wanted to keep the expertise of experienced nurses in the NHS, and he birthed this concept of the consultant diabetes nurse. And we're highly trained and experienced. Most of us have got master's degrees, PhDs, and have worked in all areas of diabetes. We're clinical leaders. We have the expert clinical practice. We work with local services to redesign them to meet the population's need. And we support our GP and other primary care colleagues, with if they need any support. So I work in Ealing at the moment, and we have a mobile phone which we carry. If a GP is seeing a patient and they need a bit of advice, they can ring that phone, they'll get immediate advice, and the patient's treated with the right treatment there and then. So treatment's not delayed, which I think is a really good thing. We work across primary care and secondary care, joining up the services so that it's not gritty. We make sure that patients can flow through every level quite seamlessly, and also that their care is not disrupted. We also work closely with CCGs and commissioning teams to commission the right services. So, for example, again in Ealing, the CCG commissions a local education training, which is developed locally and has different aspects to it. For example, we have a big Punjabi speaking population, so we have a version of the English speaking course into Punjabi, and we provide information and leaflets in the different languages around Ealing, which is really helpful. So we have a caseload of patients that are really complicated, and so we support these patients by giving them weekly calls or 2 weekly calls, or whenever they feel they need it, they can call us. So there's a two-way way of supporting our patients to ensure that they get the best care, in a timely manner. So my last slide, I'm just going to say that, again, as I said at the beginning, nurses are the bedrock of diabetes care and management. Some areas are short of them, but we recommend all diabetes services to have them at every level. Key personnel for people with diabetes or even family members to engage with. We're more accessible and have more time to give patients. Nurses are the first port of call for people with diabetes, and they can fast track you. So if there's a patient with a problem that I see in my community clinic, I can fast track them to the hospital clinic if I need to, which means that care again is not delayed. And they can be your critical friend throughout your journey with diabetes. And just to say, I don't know if many of you know, but Theresa May has quoted that her diabetes nurse is the most important person in her care and management. Thank you.